Diet is super important. We need all those nutrients. It's not just about calcium. Hello everyone. We are on our daily walk with the dogs. We've got Maui, Nimsy, and Penny. So walking is fantastic exercise. I'm a huge advocate for it, especially in perimenopause. In menopause, you shouldn't be doing so much like high intensity stuff. That's great every now and again, like, once or twice a week. But for the most part, we should just be walking. And walking at a pretty easy pace, not like power walking or anything like that. Our nervous system is going through a lot in perimenopause, and it already has enough to deal with. So if we overtax it, you're not going to get the benefits that you think you are. You're going to end up more tired, more stressed out, your adrenals more taxed. And that's the opposite of what we're trying to do. And then you're going to end up with things like more belly fat, which is that external thing that happens when we have some changes. So, walking is great. We're doing an osteoporosis workshop this weekend. Dr. Desiree Lyle and I, she's from Raise the Bar Physical Therapy. She is a pelvic health specialist, women's midlife health specialist, movement specialist. She works with men and women, and she's fantastic. She is my personal physical therapist, as well as hers and pretty much all of my patients too, if they want to do cash pay. So, what we're going to talk about is osteoporosis, what it is, how to prevent it. Yes, it is preventable. Who's at higher risk? How do we decrease our risk for developing osteoporosis? What are the implications of this? It is not inevitable that you get older and break a hip. I've had so many patients of mine tell me that, like those patients in the hospital who say, oh, well, yeah, of course I broke a hip because I'm old, so here I am, broke a hip. And then when you talk to them, they're like, yeah, my grandmother broke a hip, my mom did. I'm like, oh, so it runs in your family. Okay. So it's not inevitable. Come on, let's go, guys. That you break a hip, that you have compression fractures in your spine, that you break a wrist from a simple fall. That's an early sign of osteoporosis. So what qualifies? We got two ways of diagnosing it. One is we diagnose it with a DEXA scan, which is a bone mineral density scan. Looks at other things too. I'm going to untangle these guys. So what a DEXA scan is going to show us is what's called a BMD, bone mineral density. It measures it at the left hip, typically, unless we have like a joint replacement, we can't measure it there. And then it measures it at the lumbar spine, which is the low back. And it takes an estimation, does some fancy calculations. So the technician for this has to be very skilled and make sure that we can get reproducible results every single time. And then we compare that to what we deemed as a healthy baseline for like a 20-year-old woman. Now, there's some limitations to this. Who are these 20-year-old women that they're basing this off of? Are they white women? Are they multiracial women? Because these types of things can make a difference. We have things such as osteopenia, which is early bone loss, so it's softer bones. It's a warning sign that things are going downhill. And we have osteoporosis. And then we have normal bone density. So those are like the three things that can come off of this exam that you can see. Now, just because you have normal bone mineral density via DEXA scan does not mean that you are safe. Unfortunately, I have had patients who said, I literally just had my DEXA scan done, and they were sitting there with a fracture, with a hip fracture. So unfortunately, it's not a guaranteed that you're safe from it, but it does give us a better indication. If it's positive, then it's a really good chance that we do need to be more careful. We do need to be more aggressive with your treatment to try and reverse that, make sure we don't have any falls, make sure that we improve your bone mineral density with things such as diet and exercise. Diet is super important. We need all those nutrients. It's not just about calcium. You go over to my Substack, I wrote an entire article about it. We need things like iron. We need calcium, we need vitamin G, we need vitamin K to tell the calcium that gets absorbed where to go. Don't just sit there in the arteries and cause problems. Go into the bones where we need it. Exercise, super important, obviously. Desiree is going to talk more about that and how to do proper exercise. But whatever builds muscle builds bone. Bones need stimulus to know, hey, I have to get stronger. It's just like anything else. You don't use it, you'll lose it. So let's keep using it. And yes, walking is great. It's a great place to start. But it's not the only thing that we should be doing. We also need to make sure that we're doing progressive overload strength training. What the heck is that? Well, that's something we're actually going to demonstrate with you, for you, this weekend at the workshop. But it is essentially starting where you are. You start with body weight. You do some squats. You do some lunges. You do some overhead pressing. It has to be head to toe, guys. It's not just lower body, because osteoporosis affects every single bone in your body. So we're talking about the spine. And we need to load the spine and load the big joints, load all those bones to tell them to get stronger, stay stronger. Okay, so, and you don't need to do it like every single day. Walking every day is great. Doing strength training 2 to 3 times a week is the goal for most people who just want to stay active, want to stay healthy. And then if you're crazy like me and you want to do bodybuilding, we're obviously training a little bit more. But that is the best way to make sure that we are setting the foundation to have healthy, strong bones as we age. And then once we get to that point where we do have osteopenia or osteoporosis, guys, I cannot tell you how many times I've seen a DEXA scan that has patient has osteopenia, patient has osteoporosis in the left hip. The response that the primary care doctor puts on the report to just tell the patient about, I don't think they actually even have a follow-up visit to talk to them about the implications of this, is tell them to take vitamin D and do weight-bearing exercise. They don't specify what the crap that is. They don't talk to them about diet. They don't talk to them about treatment options to improve bone mineral density, like first line is bisphosphonates. They don't talk to them about any of that. And that's freaking crazy to me. Because once we're at that point, like I can give you estrogen in perimenopause and menopause, right? Estrogen is necessary for bone mineralization. When we lose estrogen, it's a bone building hormone. It's also a muscle building hormone. It's so important to our bodies, guys. And as we lose that, we start to break down our bone faster than we're building it up. Now, we cannot reverse osteoporosis or osteopenia with estrogen alone. Estrogen prevents that from happening very effectively, but it will not reverse it. There are limitations to HRT. So that is why we want to start you on it early for prevention, not just for your hot flashes right now. And if you don't have hot flashes right now, that doesn't mean you don't need estrogen. That's why a good evaluation with a hormone doctor such as myself is very important to see if that would be appropriate for you. Talk about the risks and benefits and monitor you properly. Now, once we get to that point of osteopenia and osteoporosis, then we need to start talking about risk and benefits of starting you on an anti-reabsorptive or an anabolic medication that will help to rebuild your bones, or at least keep them from breaking down faster than they're being built up. Your bones are very, very metabolic. They're always being broken down and built back up again. It's like your savings account. It's your retirement account, okay? We start building it up when we hit puberty. We start taking more than we put in around our 30s. Now, what I talked about before as far as nutrition and exercise, strength training, those things help to slow down that process of it getting broken down faster than we're taking out. But things that can break it down even faster, menopause, decrease in estrogen, we know that, smoking, poor nutrition, standard American diet, stress, who is not stressed, and family history can definitely influence as well. So if you have a family history of osteoporosis or osteopenia, you have a family history of hip fractures, mom or dad's side, it doesn't matter. Men can have osteoporosis too. They don't typically have it at the same rates as women do. They actually have worse outcomes, though, than women do. There is a roughly 30 to 40% increase in mortality and morbidity, like increased rate of death in the first year after a hip fracture for women. It's worse for men. And men are within like the first 6 months. So this is serious, guys. This kills people, and it's not old age. They didn't die from old age. They died from weak bones, soft bones that broke, and they couldn't move, and then they get pneumonia, or they get a bed sore, or they get a blood clot. That's what takes them out. Not old age. That's not old age. So, and those who actually return to their baseline of mobility before the fracture, it's not great. Like, that's our goal, is to get you back to that baseline. But if your baseline's not good, it's not good. So, these are some of the things we're going to talk about at the workshop on Saturday. 10:30 a.m. CrossFit Unrestrained in Pasco. Dr. Desiree Lyle and myself. We have some really amazing sponsors too. We're going to have a door prize that we put together. It's like 120 some, at least, probably more than that, like $200 worth of goodies in the bag. We're going to have goodie bags for every participant who comes in. And all proceeds are going to go to the Osteoporosis Foundation. So, really excited. This is going to be like a regular thing that we're going to do, Dr. Desiree and I, because we really love educating people. And that's our whole goal in life. That's why we're doing this. That's why we broke away from the traditional medical model. So, I'm eating my hair. So that we have the ability and capacity to do these types of workshops whenever we want to. So I hope to see you guys there. If not, definitely just let me know if you're interested in topics like this. And I will see you guys on the next live. Bye.